Quebec has decided to give the AstraZeneca vaccine to seniors, which, as you'll recall, this was a big issue last week, goes against the guidance from Canada's National Advisory Committee on Immunization. Michael Serapio is here as Quebec, Michael, once again sets its own course.
Absolutely, and good morning, Heather. And there may be some confusion around the Oxford AstraZeneca vaccine, but Quebec, as you say, will go ahead with administering this vaccine with seniors in the province, people who are older than the age of 64, so 65 and up, arguing really that in the midst of a pandemic, AstraZeneca has many advantages. Now, that may surprise some people, and as you say, there is conflicting advice right now from both Health Canada and the National Advisory Committee on Immunization. Health Canada approving AstraZeneca for all adults, but NACI saying the preferred vaccine for those 65 and older are either the Pfizer or the Moderna vaccine. And that's because the AstraZeneca clinical trials had a low number of participants over the age of 64. But as you know, Heather, the UK has been using AstraZeneca widely with seniors, and its real-world data is showing great efficacy. Take a listen now to Dr. John Edmonds, who's an epidemiologist with the London School of Hygiene and Tropical Medicine.
We're using two vaccines in the UK. We're using the BioNTech Pfizer one and the AstraZeneca vaccine. And the results of those studies basically show no difference in the effectiveness of the vaccines after one dose.
No difference that they are noting in the UK after seeing what they've done with Pfizer and AstraZeneca vaccines. Despite that UK finding, though, because of the NACI guideline, provinces like Ontario and Manitoba, they're going to limit AstraZeneca's use to those under the age of 65. Nova Scotia does not expect to use much of the vaccine at all at this point, but Quebec will go ahead and use it with every adult, saying adding the vaccine to its supply gives the province more flexibility with their inoculation efforts, and it helps with mobile campaigns, giving people shots at home, because the AstraZeneca vaccine, Heather, does not require freezing and can be used upwards of 48 hours after opening a vial.
So we know, Michael, Quebec got about 113,000 doses of the AstraZeneca vaccine from last week's shipment, 500,000 doses into Canada all told, and no more coming of that vaccine this week. What are other provinces doing with what they received?
Well, they are going to start using it, and that's what we're already starting to see, for example, in Alberta, as they are now going to start tomorrow registering older adults in the province, so those age 50 to 64. They can start booking appointments to get the AstraZeneca shot in Alberta. Also eligible are Indigenous people in the province who are 35 to 49 years of age. Appointments, we should point out, will be open one birth year at a time. For example, tomorrow's rollout begins with anyone born in 1957, 1972 for Indigenous people, and other birth years will be announced going forward. As for Ontario, the province will start distributing the Oxford AstraZeneca vaccine to pharmacies in Toronto, Kingston, and the Windsor-Essex area. This is a pilot program, and the details we still don't know much about right now, but again, the province is limiting the use of this vaccine for those 60 to 64, at least for now, and the Ontario Pharmacists Association says the first shots of this vaccine could begin as early as next week, Heather.
Michael, thank you very much.
You're welcome.